helping make your life easier. Moms Every Day.
Good afternoon. Welcome to Moms Every Day. I'm Katie Wilson, and today we have Dr. Mariana Lanata. She specializes in pediatric infectious disease at Cabell Huntington Hospital. So thanks for joining us.
Thanks for having me.
Yes, a first-timer on the couch. So we are in the middle of flu season, so I do have a lot of questions about that. But first, why don't you just tell me a little bit about your role at Marshall Health?
Sure. So as a pediatric infectious diseases specialist, I help take care of infections, so either bacteria, viruses, or parasites that are either more severe, uncommon, or harder to manage. So examples are infections in our blood or near our brain.
Okay, so in terms of the flu, what's the difference between the colds and the flu?
So good question. They both have similar symptoms, and most of the time it's hard to tell them apart. As a general rule, the common cold is milder. It presents more gradually, so your symptoms will appear over several days. You may or may not have the fever, and it usually lasts shorter. The flu, on the other hand, kind of presents all together.
Yes.
All your symptoms will show up usually within a day. Fever is almost always present. That fever tends to be higher. Besides respiratory symptoms like cough and congestion, GI symptoms are more frequent, so you can have vomiting. And with flu A, very characteristic is severe muscle pain. This is just a general rule. The only way of really knowing what you have is to go to a doctor and get tested.
Sure. So we talk about this all the time, but what would be your advice on how to stay healthy during cold and flu season?
Right. So very important. The common misbelief is that we spread the viruses while coughing. But actually, it's our hands that are the problem. So just think about it. If I have viruses in my hand and I go open a door, how many people are coming behind me that are touching that same doorknob? So very important is to wash your hands. The other thing you can do, instead of coughing and covering your mouth with your hand, is coughing and covering with your elbow. In general, if you're sick, try and avoid handshaking. Try and stay home. Avoid overcrowded areas like the movies, so you're not exposing your virus to a lot of people. With the flu, the single most important thing you can do is to get vaccinated. So ideally, you want to get the vaccine as soon as it's available. Usually that's around September, October. So you're protected before the flu season actually starts. However, it's never too late. This flu season is really bad. With kids, we're already seeing double the amount of deaths compared to last year.
Goodness.
So if your kid is not vaccinated this year, it's very important. Please take them and get vaccinated as soon as possible.
Okay, and so we talk about getting your flu vaccine, of course, every year. Why do you have to do it annually?
So the flu is caused by the influenza virus, but there are many, many different types of this virus, and they change every year. So that's why we need a new vaccine every year. I do want to know that the vaccine is not perfect, so even if you have the vaccine, you may still get the flu, but what the vaccine will do is prevent to stay you out of the hospital, needing intensive care, needing intubation, and ultimately dying from the death. And this is even more important in our high-risk population, which are usually our young kids, our elderly, pregnant women, or patients with chronic conditions such as lung or heart problems.
Okay, so let's say, we get the vaccine, we still end up getting the flu or the cold. Do antibiotics help to treat that?
No, so antibiotics only kill bacteria. For the common cold, there's actually nothing you can do. So we kind of try and manage symptoms. For example, you can take Tylenol or ibuprofen if you have headache or fever, but it's ultimately your body that needs to fight the virus to get you better. For the flu, we do have an antiviral medication. However, it's very important that you take it between the first 2 days of illness, because that's when it works best. So that's why if you think you have the flu, it's very important to go early in your disease to the doctor to get tested and treated if necessary.
Okay, and now in terms of the cold, you were saying there's not much you can do. If you have a child who has the cold, when does it get bad enough or serious enough that you need to go to the doctor?
Right, very important question. So in general, if you think you have the flu, so everything kind of shows in the same day, as I told you, you can take your kid to your regular pediatrician for a sick visit. Please make sure you grab a mask as soon as you enter your doctor's office to try and help other patients stay safe. If your pediatrician doesn't do sick visits, another place to go is an urgent care where you are sure that they'll be seen that same day. However, if they're breathing really fast, they're having trouble breathing, and usually you can tell that because their ribs are showing when they're breathing, or the skin above the collarbones kind of sink. In smaller kids, you can see their nostrils open, or even in babies, you can see them head bobbing. If they're breathing really fast that they can't drink, or they're just turning blue, or really sleepy where you can't wake them up, that's when you go straight to the emergency room.
Okay, so many important things. Thank you so much, doctor.
Thank you for having me.